Welcome to the Training for Healthcare Professionals. Let us learn about hand scrubbing today. Let us take a look at the key learning objectives. After completing this lesson, you will be able to describe what is a surgical hand scrub, perform a surgical hand scrub, and reduce chances of surgical contamination due to poor hand hygiene. Let us first understand what hand scrubbing is. Click the images to know more. Microorganisms transfer from the hand of healthcare providers to patients. So, hand hygiene is very important in healthcare. Surgical hand scrub, also known as hand antisepsis, refers to an antiseptic hand rub that is performed prior to wearing surgical attire before an operation. Let us now have an activity and try to explore why hand scrubbing is required in place of regular hand wash. Drag and drop the correct options to the wash basin. Hand scrubbing is essential to reduce spread of germs to surgical wounds, remove microorganisms before wearing sterile gloves. The goals of surgical scrub include the following. Click each hot spot to know more. To remove debris, soil, hand lotions, natural skin oils, and all microorganisms from the hand and forearms of the sterile team members. To keep the number of microorganisms on the skin to a minimum. To decrease the risk of microbial contamination of the surgical wound. Now, let's see when and for whom hand scrubbing is essential. All surgical team members who come in contact with the operative field. Hand scrubbing is a must for gowning and gloving before surgical procedures. Let us now identify the items needed for hand scrubbing in this activity. Drag and drop the items needed for a surgical hand scrub into the tray.
Sister, isn't hand washing enough for healthcare workers? Do we really need to follow hand scrubbing too?
Yes, B complex. We need to follow hand scrubbing too at times.
How are they different from each other, sister? Is there also a difference of procedure?
Yes, there are indeed a lot of differences, B complex. Can you find any difference in these two images? Look at them carefully.
Yes, sister. One image is showing washing of palms, while the other shows that along with palms, wrist and forearm is cleansed.
Absolutely correct, B complex. The former is hand washing, while the latter is of hand scrubbing. The procedures are different for the two. Come, let's see the correct procedure to scrub your hand. Click each step to know more. Preparation. Remove all jewelry, rings, watches, bracelets. Regulate the flow and the temperature of water. Open package containing nail brush and keep aside. Wet hands and arms with water. Antiseptic wash. Take enough surgical soap or antiseptic wash. Work up lather, then wash the hands and arms thoroughly to the elbow for 1 minute. Rinse hands and arms thoroughly, allowing the water to run from the hands to the elbows. Do not shake the hands and arms. Let the water drip from them. Brushing nails. Remove the sterile brush and file from open package. Moisten brush and work up lather. Soap fingertips and clean the spaces under the fingernails of both hands under running water. Lather fingertips with sponge side of the brush. Then, using bristle side of the brush, scrub the spaces under fingernails. Washing fingers and hands. Lather fingers, then scrub all 4 sides of the finger with the brush and wash each finger. Begin with the thumb or little finger. Lather palm, back of hand, heel of hand and spaces between thumb and index finger, washing each surface. Washing arms. Move up the forearm, lather, then wash to the elbow. Wash one hand and arm completely before moving on to the other hand and arm. Rinse hands and arms. Allow the water to drip from elbows before approaching the gown pack. Drying hands. Pick up a hand towel from the top of the gown pack. Grasp the towel and open it. Do not allow the towel to touch any unsterile object or unsterile parts of the body. Holding one end of the towel with one hand, dry the other hand and arm with a blotting, rotating motion. Work from fingertips to the elbow. Do not retrace any area. Dry all sides of the fingers, the forearm and the arms thoroughly. Grasp the other end of the towel and dry the other hand and arm in the same manner as above. Discard the brush and the disposable towel into the appropriate bin. Let us now summarize the important points. Click each image to know more. Nails must be free of any nail polish or art. Hands or forearms must be free of any skin breaks or lesions. All rings, watches and bracelets must be removed prior to scrubbing. A vigorous 2 to 3 minute hand scrub and forearm scrub or a counted brush stroke method to be practiced. Remember, 30 strokes for nails, 10 strokes for fingers and each surface at least 10 strokes.
Welcome to a video on hand scrubbing. This video is brought to you by Vadvani Foundation. Material needed: head cover, face mask, nail brush package, brush, nails cleaner or scrubber, sponge, medicated soap, a sink with hot and cold water. Preparation: remove hand jewelry and watch. Regulate the flow and temperature of the water. Wet hands and arms with water. Antiseptic wash. Take enough surgical soap or antiseptic and wash the hands and arms thoroughly to the elbows for 1 minute. Rinse hands and arms thoroughly, allowing the water to run from the hands to the elbows. Let the water drip from them on its own. Do not shake the hands and arms. Brushing nails. Use the sterile brush and work up lather. Soak fingertips and clean the spaces under the fingernails of both hands under running water. Washing fingers and hands. Lather fingers, scrub all 4 sides of the finger and wash each finger. Begin with the thumb or little finger. Lather palm, back of hand, heel of hand, and space between thumb and index finger, washing each surface. Washing arms. Move up the forearm, lather and wash to the elbow. Rinse hands and arms. Allow the water to drip from elbows before approaching gown back.